Hi, I'm Grace and welcome back to If I Got Laid Off Tomorrow, my series where for the whole month of August, I'm sharing low barrier but high potential careers that I would consider if I got laid off tomorrow. And today's job is patient care coordinator. Patient care coordinators act as the liaison between patients and the healthcare system. They may act as the front desk receptionist. They schedule appointments, explain treatment plans, may coordinate between the patient and their insurance provider. But each role will be very specific to the location of the job and what that job might specifically require. But essentially, make sure the patient has everything they need in order to follow through on their care plan. It might require some coding, prior healthcare experience. It's almost like a catch-all position for some offices. They want to make sure that they have someone on staff that is taking care of all the patients. You'll be the go-to person for patients navigating a really complex healthcare system. So most patient care coordinators work in hospitals, specialty clinics, or outpatient centers. But you'll also see these roles in the dental industry and in lots of different healthcare practices. Some focus in specific areas like oncology, primary care, or rehab. Many of the positions are in office where you'll be coordinating one-on-one with the client or operating the front desk, but a lot of healthcare systems are moving these positions into more hybrid or remote roles, especially if the main focus is scheduling or making phone calls or follow-up calls. There are lots of different roles that kind of fit under this category. Patient care coordinator is one title to look up, but there's lots of different roles that may have different requirements, but essentially you'll also want to look for titles like client care coordinator, patient services coordinator, patient access representative, medical office coordinator, patient services specialist, treatment coordinator. There's really a bunch of different titles that you'll want to look up when you're looking for these kind of roles. For training, most employers will ask for a high school diploma or a GED, and many will prefer some background in healthcare, but there are also entry-level roles. But any previous work experience with customer service, data management, or scheduling will be a big plus. Some may require certain certifications to get as well, such as certificates in medical office administration, medical coding or billing, or health information. These can all boost your chances. Strong communication and organizational skills will be very helpful in this role, especially since you'll be coordinating across doctors, patients, and insurers. Some of these jobs aren't always on the job boards. You'll definitely want to look at any of the hospitals or medical clinics near you and go to their specific career site because a lot of times they'll post jobs right there directly. Pay will typically start out anywhere from $17 to maybe $22, $24 an hour, with experienced coordinators earning up to $45 to $55K plus. It's not the highest paying healthcare role, and the workload can be heavy with constant phone calls to make and patients to schedule, and lots of paperwork. But as we've talked about, the healthcare industry continues to grow. It can be especially rewarding if you like helping people, and it's a solid stepping stone into healthcare administration or case management, which is why if I got laid off tomorrow, I'd consider becoming a patient care coordinator. Make sure to follow for more overlooked but high potential careers that you should consider, and if you're a job seeker looking for resources, feel free to check out the link in my bio. See you tomorrow.